That deep, chesty cough may sound like a seal's bark, but plenty of parents have heard that distinctive sound a little closer to home, in their child's bedroom during a bout of croup.
I'd heard the sound before, and her sound was exactly like that the first time she had it. And it's, that bark is, you just know what it is.
Teresa Smith's daughter Sophie has suffered through multiple bouts of croup, the last of which sent her to the emergency room. It was scary, Teresa says, but not as scary as it might have been if the family hadn't been through this all before with Sophie's older brother.
He was kind of classic, barking in the middle of the night, which totally made us crazy. So we took him to the ER, and by the time we got there with the damp night air, he was better. We kind of felt foolish going in.
She shouldn't have.
Guys, how you doing?
Croup can be quite serious, so as the Smith's pediatrician confirms, it's better to be safe than sorry.
Most kids with croup, the vast majority, do fine with a couple of simple measures at home, and the few that don't, almost all of those do fine with some measures that we can do in the emergency room, but it can be very severe and can be life-threatening.
And certainly unsettling. The first time Lulu Samuels was awakened in the middle of the night by her daughter's barking cough, she had no idea what to do, so she called 911.
Her collar was already kind of like getting to the bluish color. She couldn't get any air on her. So by the time the paramedics got there, we were holding her outside in the middle of the street. They got her right away. The guy took a look at her. In 1 minute, he decided, he made the diagnosis, and then he told us to run to the shower and put the steam on inside the bathrooms, and then turn the shower as hard as we could to let the steam, and that released some of the bronchospasm.
If Lulu lived in a cooler climate, just bundling her daughter up and bringing her outside might have helped.
Cold air coming in helps to decrease the swelling in the airway. And a lot of times they'll get outside and after a couple of minutes settle down and breathe a little easier.
Cold weather and steam are the most basic and effective home remedies for croup. But if they're not helping your child breathe more easily after 15 or 20 minutes, she may need immediate medical attention. Watch your child for the following clues. She struggles to breathe. She makes a whistling sound that gets louder with each breath. She cannot speak for lack of breath. She drools or has difficulty swallowing her saliva. She seems lethargic or inconsolable. She appears pale or has begun turning blue. If you notice any of these signs, take your child to the emergency room or call 911 immediately.
If it feels like it's out of your control and the baby is just not responding and getting worse, I would never hesitate. In fact, even Dr. Harkness has told me, he said, just take her and have her looked at. What's the worst? They send you home.
The majority of children with croup do fine. Most of them we see in the office. We treat with steroids. We have them use a vaporizer at home that night to keep the airway nice and moist. We give them lots of fluids and the kids do fine.
One double orange, Eva, good job.
Raquel and Eva are doing better than fine. Although they still have the occasional bout of croup, Mom knows just what to do to make them feel better and to prevent the illness from dragging out for 5 or 6 nights like it used to.
They wake up, with a cough, and then we start the prednisone, the drug right away, and we do the steam, and then the next day, it just goes away.
For the girls, that means they can turn their attention to more important things, like being girls.
I'm giving you more life.